And it was just on the front end of the process of working through Meaningful Use Stage 1 that we learned that AHEC has some resources out there that can be helpful to us. So we thought, well, we'll tap into that, and it's valuable to us. And at the end of the day, our goal was to be a Meaningful Use Stage 1 practice. Then it became time, we decided we wanted to work through Patient-Centered Medical Home. And they said, hey, we're there, we can help you through that too. Well, we wanted to be a level 3 practice, level 3 PCMH practice. So we're almost there, and we're happy because AHEC has been there for us.
You know, having Northwest AHEC available and having their resources, health coaching was, or motivational interviewing was. So, you know, those are positive things that I learned with AHEC, and that the whole staff has learned. We've gone through motivational interviewing with tobacco smokers or tobacco abusers, and there was a whole program that North Carolina offered. It was called Quit Now. The whole program that we had no idea about. So, you know, that was something that we brought back to the practice, and we've had people quit smoking with this program. It's been a very positive outcome.
Is really elevating the quality of care in free clinics across North Carolina. They've been providing quality care for many, many years, but we have, with our partnership with AHEC, have been able to start to document how they're doing that. So it's not just about how many uninsured people did you see last year, but of the diabetic individuals you had, how many of them health improved? And so that work has been instrumental as the Affordable Care Act starts to roll out even more this year and next year. It's going to be critical that organizations can demonstrate that they are providing quality of care, and our partnership with AHEC has done that for us.
Over the last 2 years, we have become more of a front runner in the pediatric world, whereas a few years back we were behind everyone else, and Northwest AHEC has given us the guidance to pull us out and help us lead the front, where we have other practices at conferences ask us how we do things, where we're giving them direction and helping them with things.
I think that AHEC has helped us with Debbie's help, has also been with steps that we're going forward, learning to do the patient-centered medical home, and those steps forward, trying to combine everything into one thing to meet those goals.
Northwest AHEC is my first choice. When the need became apparent to me that we had an issue with the new Board of Nursing requirements and how was I going to meet those, I made a phone call to Northwest AHEC, and you know, we were able to get together a group of folks who could sit down and come up with a plan to not just help me, but to meet the needs of other folks across the state.
I think the collaboration with Northwest AHEC is critical for our future growth, as we not only want to expand existing programs but add new programs. The partnership with Wake Forest and PA Studies, physical therapy, nurse practitioner are all programs we desire, and having the Northwest AHEC as a partner will help us in placing students in the rural areas and trying to get access to clinical spots, and I think also will help us build our infrastructure so needed.
The opportunity to come in and be able to give them a webinar, an hour webinar that actually is accredited, that the docs can get CME on, and also their nursing staff I think is an amazing opportunity. 40 years of being in the business and being relevant over a 40-year period is pretty amazing this day and time. To be able to stay up in this fast-paced, ever-changing world that healthcare lives in and continues to live in, to have a resource like them, and like I say, for them to stay relevant, just kudos to their leadership and their staff.
The challenge going forward now is the new way in practice innovation. There's a lot of those changes going across. How do we do better? How do we do better population management? Frankly, I've been very grateful for AHEC, so to me, it's an easy topic to talk about and talk with the individuals, and so I'm hoping that the state of North Carolina continues to support something so important, especially in these challenging times.